Hey, has your baby's head started to look a little lopsided? Like they've been sleeping on their side since 1997? That's okay, it's super common. Newborn skulls are not one solid bone, they're actually made of multiple plates. Why? Because nature said we need to get this head fit through a tiny little exit. So those plates are designed to move and overlap during birth. But because they're plates and they're not a solid helmet, they can also shift shape a little after birth. Now add two more very normal things. Babies sleep on their backs to reduce the risk of sudden infant death syndrome. And number two, some babies have something called torticollis. This is where one neck muscle, called the sternocleidomastoid muscle, is a little bit tighter on one side versus the other, so it makes them look like they have a preference for a direction. Now we have soft skull plates laying on the back and a head turn preference, and that all equals a slightly misshapen head. This is called plagiocephaly. You might notice the ears look a little off, or there might be an asymmetry on the back of the head, and this is understandably a little bit panicky for parents. But here's the key: most cases fix themselves. By 9 months or so, babies are rolling, sitting, doing tummy time. They're not living on the back of their head anymore, and the skull rounds out beautifully on its own in the majority of babies. Your pediatrician should be checking for this at visits, and only in more significant cases do we refer to a specialist to see if like a helmet is needed, which is way less common than the internet makes you think. So if you're staring at your baby's head at like 2 a.m. and you're convinced something is wrong, you're not alone, and it's probably very normal. Follow up with your pediatrician and follow here for more why your baby looks weird but is actually fine explanations.